I'm Marion Herring. I work for Advanced Orthopedics. I'm a sports medicine and shoulder specialist. The most common shoulder problems I see in my clinic, number one, really revolves around the rotator cuff. It can include inflammation around the rotator cuff or all the way up to a rotator cuff tear. Second most common shoulder diagnosis would be shoulder instability. This is when the patient's shoulder has popped out of place and they feel like it's just not stable. The third most common would be shoulder arthritis. Over a long period of time, they develop degeneration in their shoulder joint, which leads to pain. Almost everyone has some type of shoulder problem. That can be from the very young, which means usually is centered around their shoulder stability. Middle age can be centered around the rotator cuff, and the older age, you're going to have more difficulty with arthritis. It's our most important factor to find the correct diagnosis and what the correct pain generator is. We usually see those patients in the clinic. We take a careful history, including how they got hurt, their quality and quantity of pain, and what they've done to get better. This usually then moves into a physical exam where we look at their range of motion and strength in all different areas. And last would be usually an x-ray is taken to look at the bony anatomy to make sure it's okay. Most shoulder treatments can be started conservatively, which means without surgery. Our first goal is to find out what the correct pain generator is. We can usually address that pain with medication, anti-inflammation medicine usually, injections, which is steroid injections, and then once we get the inflammation better, we usually start a structured strengthening program, which makes most shoulder issues get better. Usually, if they don't get better with that conservative measures, they require more advanced imaging, which would be an MRI scan or a CT scan. We use that information to decide if surgery is needed.